Pistoresi. I am Secretary of the Board here at Camarena Health Centers, and what the health center means to our community is that it provides services that the underserved and underrepresented might not normally have. It keeps them out of the emergency room where the care is much more expensive. They can have their own physician here, and they could be absolutely trailed in regard to their health care. If they have diabetes or hypertension, they are alerted to come in and be tested and keep up their health. So it's also preventative, and that's part of the thing that we're all about is helping keep people.
My name is Dr. Waldemar Rosario. I'm the Chief Medical Officer for Darin Camarena Health Centers. We are the largest provider in the Madera County, and we provide services for the underserved, including mostly medical patients, but also private pay patients and insurance patients. We have 4 facilities, and we are the largest provider in this county, so basically we are very important in our community. We give all the services regardless of your means to pay, and we provide everything from family practice, pediatrics, women's health, and also dental in most of our facilities.
My name is Paulo Soares. I'm the CEO for Camarena Health Centers in Madera, California. And the reason that our community health center is so important to our community is that it provides opportunities for residents of our community to access health services and dental services that they may otherwise be unable to access. And that's because of our sliding fee schedule that we offer to our uninsured patients, as well as the insurance enrollment services that we provide to help our residents get access to different programs. And we help bring partners together in our community so that residents are aware of many of the different resources and services that are available to them. And in a community such as Madera, a community of 55,000 people, we treated nearly 22,000 patients last year for nearly 80,000 visits. And so we really are a primary source of preventative and primary care services for the residents in our community.
QHCs and what we mean to the patient population, but you always seem to get it. And I always like coming to the table with you, with other folks, because you always say, hey, let me take a minute, let me tell you about what they do for us. So we appreciate that. And we understand that it's a tough year, we get it, but we know that we at least have somebody that understands us and is always willing to work with us. And Tanya always gives us the call as well too, like, hey, what are some good issues for us to take a look at, or where should we be looking? And that's what an advocate is for us. It's not always the one that does the yes or no vote. It's always the one that's looking out for us. You always look out for us. And so
well, I'm honored. Thank you so much.
Thank you. So there's our Central Valley champions.
Good. Well, thank you, brother.